Hello everyone, welcome to my channel. Today's topic is impacted earwax from medical surgical nursing from the unit ENT, ear, nose and throat. Let's get started with the video. Impacted earwax. To understand about impacted earwax, first of all, we need to understand what is earwax. Earwax, also called as cerumen, is a natural protective oily production from the middle ear which is produced in the outer third of the ear canal. It is a brown, yellow, orange, reddish or grey substance which is secreted in the ear canal, which is secreted by ceruminous gland. Its function is to protect the middle and inner ear from all the external particles. Also, to remove the unwanted things that are trying to enter the ear, might it be living or non-living. Basically, its function is to protect the ear canal. This is the ear canal, middle ear, and ear is the production of earwax by these glands. This is the earwax, anatomical location of the earwax. So, when there is excess collection of thick earwax at the auditory canal, it is known as impacted earwax, which is characterized by diminished hearing. There is no total stoppage of hearing, but yes, there is diminished hearing. So when someone tries to clean the ear by using earbuds, by using anything from outside, we are likely to push the earwax inside. Instead of cleaning the earwax, we are most likely to push the earwax inside. Ear canal as a self-cleansing system. Whatever is not needed by the ear canal pushes it outside. So we don't need to clean the ear canal artificially from outside. Yes, there might be itching sometimes. We can clean it by using a soft cloth, but we should not use earbuds every time. We are most likely to, as I said, push the earwax inside, which might create impacted earwax. This is the condition. Causes can be, first of all, same, use of earbuds to clean the ear, foreign body in the ear. Foreign body might also push the earwax inside, blockage by the bone. Whenever there is any condition like fracture, there is blockage by bone. Infectious disease like otitis media, anatomically narrow ear canal, skin disease such as eczema. Skin disease such as eczema might create some production which might push the earwax inside. Or when there is anatomically narrow ear canal, the production and the space might have a disbalance. Small space, normal production might also be more. Symptoms can be, first of all, diminished hearing because there is impaction of something, discomfort of the ear. Discomfort in the ear is a feeling of something which is blocking the hearing. There is no pain unless earwax is pushing the eardrum. Till the time earwax is not touching the eardrum, there is no such symptom, no such pain, otalgia. But by the time earwax starts to push the eardrum, otalgia begins. Because the earwax is naturally designed to protect the ear. That doesn't mean it is always middle ear friendly. It protects the ear, yes, it protects the ear, but while it touches the eardrum or tympanic membrane, it might create some disturbance. Also, tinnitus, a ringing sensation in the ear might occur. While diagnosing this condition, first of all, symptoms should be diagnosed. The symptoms like difficulty in hearing, symptoms like feeling of fullness in the ear should be diagnosed. That might be the chief complaint of the patient visiting the hospital. After that, any kind of discharge, any colored discharge, uncolored discharge, liquidy or solidy discharge should be taken into consideration. After that, we can do otoscopy to visualize each organ in detail. We can use otoscopy. This disease can be managed by the use of ceruminolytic. Cerumen is the production. Ceruminolytic is something that destroys the excess production. For 4 to 5 days, if we apply ceruminolytic, that can melt the production of earwax, the produced earwax. If it is not managed in that way, then first of all, we need to instill some drops, some medical drops and then we can remove it by using wax hook. Wax hook is similar to scraper that we learned in previous disease. That scraper holds the earwax and brings it out of the ear. Cerumen hook can also be used, formed by cerumen hook and scoop. Hook as a double-sided teeth, scoop as a one-sided teeth. That can be used to remove the earwax outside. After that, ear drops. The self-care ear drops, which is ceruminolytic, can be instilled in the ear, which can soften the earwax. After softening of earwax, the earwax might naturally come outside, excess earwax, or it will be easier. If it doesn't naturally come outside, it will be easier to remove it outside. So use of ceruminolytics medically is important. Also, home-based management can be olive oil. It can be poured in the ear to soften the earwax. Any random oil cannot be poured in the ear. Okay, only the use of some kind of mineral oil, olive oil, can be done. Any mustard oil, coconut oil should not be poured inside. It might thicken the earwax more. Next, management, use of earphone and earbuds should be avoided until treatment is going on, because that might create more irritation. The sound produced might create more irritation to the ear. Ear irrigation can be done medically to improve hearing, because as we do ear irrigation, the fluid softens the excess earwax and the space for the sound wave to travel becomes smooth. While irrigating, the fluid should be minimal if the patient has a history of mastoid surgery or otitis media externa, because if we pour more than 20-30 ml of fluid at once in the patient who is already having the existing infection, then that might aggravate the infection. So we should minimize the amount of fluid in the patient who have a history of ear disease or a history of mastoid surgery. This is the irrigation cup through which fluid can be supplied. And this is irrigation syringe. Both way we can instill the fluid, whichever is available in the hospital or whichever is okay according to the hospital procedure, it can be used. Thank you so much. Next video will be about next topic regarding same ENT unit.